Now, in today's world, there is a great and high expectation from people in the professional field. Now, when I'm in the professional field, I'm talking about doctors, I'm talking about engineers, and the rest of them, everyone in the professional field. There is this high expectation from them, and there is this, will I say, godlike expectations from them to always behave and practice as though they are not human beings. Now, this has already put a lot of pressure on these persons, which I've mentioned earlier. So now we're gonna be talking about this. This is gonna be the big question we'll be asking: balancing compassion, pressure, and personal life in the professional work life. How do these professional people balance their lifestyle? How do they balance their personal lifestyle from their work lifestyle? How do they try as much as possible to not be weighed down with a lot of pressure? So, joining me to discuss this episode, I am joined with a dental doctor in the house, in the person of Dr. Ugochukwu. Sir, you're welcome.
Thank you very
How are
much.
you feeling today?
Oh, I'm great, and it's nice being here once more.
Yeah, thank you, sir.
You're
So
welcome.
it's such an honor having you today. I would love to get your own view. Like you said earlier, this is a personal, is something broad. Like a lot of people have their own, say on this topic. So my people, stay locked in, stay tuned in as we understand this. Don't go anywhere. So moving on, sir, what does a normal work day look like for you as a dental doctor in the office?
Well, for me, it's very unpredictable. I usually like in my clinic section to someone that has a store.
Okay.
You get you come out without any expectation. You don't know how rough the day
The
will
day will
be
be.
or how busy it will be. For me, it's unpredictable. There are some days I get to work, and from when I step into my office till the end of working day, I don't rest. While the other days, you just come and everywhere is just calm. You not be asking, where are all these people? Where nobody's having any two challenges today. So
Mm.
it's not pretty unless I have a pre-programmed appointment. Like I've seen some patients, we book appointment for them to come. But if it's just on a regular day, it's not pretty. You can't tell what you will meet. You don't know the kind of patient you'll be expecting.
Mm.
You just go to work with an open mind.
Okay.
If you see the simple cases, fine. If you see the difficult, you just have an open mind to your
Okay,
day.
let's talk about your relationship with your patients.
Okay.
How will you describe the relationship with them? Is it on, work basis, or do you go more personal with them?
Okay. Well, for me, it's not the same with every patient. I try to read the room. I try to read my patient depending on the age. The way I relate with children is different from the way I relate with teenagers. It's different from the way I relate with adults and elderly. No, I read the room. I try to study my patient psychology. You get there are
Mm.
some patients that talks a lot you want to, but I try as much as possible to ease them into any treatment I'm doing because they want to be at home. Nobody wants to come to the clinic. The
Yes,
clinic is not
yes.
where they want to be. So
Yeah.
they are coming because they have an issue. So I try as much as possible to make the environment very cordial and relatable. So I come with my smiling faces. Oh, good afternoon. How can I help you? Depending, and I don't talk to everybody with the same tone.
Yeah.
You get when I'm working on a child, you should know I should be I'm very subtle. Like, give me
And
high five.
playful.
I'm playful. Then when I'm talking to but generally I like a relaxed room. It's easy for your patient to open up to you when the room is relaxed, not official. I don't like being official with my patients.
Mm.
So I ease them into the treatment, let them know the expectations and the
So
rest of
you
them.
also bring compassion into
Yeah,
this,
the
or like,
job. We are in the hospitality business. You must be compassionate because, as I said, if they have their way, they just want to be at home. Nobody wants to just go to the clinic. You get there. Dentistry is a mix of both. You get we have the aesthetic part of dentistry. We have the therapeutic part where you are in pain. you want relief for your pain. Why some people just want to beautify their, those people coming in for beautification is different from
From
people
people.
coming in for pain. It's
Yeah.
not the same thing. So you have to be compassionate with everybody. And another thing I try to do is educate my patients, because you may think you know what you want, but as a professional, I should be able to guide you better towards what you need. Want and need are not the same. You get,
Okay.
so it
Okay.
helped me with
So
every
in
patient.
this situation, has there been a time when being too compassionate has really caused a lot with the patients?
Yes. I have see, not just me, even with some of my colleagues, we've come to the agreement. Sometimes when you're trying to help some patient, that patient you're trying to help may end up putting you in trouble,
Wow.
because you'll be like, if I know, I will just leave this patient.
Mm.
You get those cases that the patient come in shouting, "Doctor, please," may end up becoming a very difficult case. Sometimes the patient will now start turning back on you and ignoring all the help you assisted. I say, no, no, doctor. We see that a lot,
Mm.
but that doesn't stop us from trying to be helpful. And you see, there are some patients that will come to you, doc, I don't have. You build them out of compassion. You say, okay, let's spread your payments.
Yeah.
Now, after you're done with the first set of treatment and you give them appointment for the next set of treatments, just because they are owing you, they won't turn up. You get,
Mm.
and it becomes very, very irritating, because you came in with pain and
And
you
I
were
helped you out.
begging
Yeah.
for me to treat you, and I went ahead to treat you. Now you're a bit comfortable, you're not absconding with payment. That's why some doctors will never touch any patient without the patient making full payment or anything. You get, there's this saying, man makes man wicked. So
Yes.
it's from your past experiences that,
That teaches you a lesson.
yes. So
Okay.
we see that a lot too.
Hmm. So now this question just came in abruptly,
Yeah,
right? What about, like, we are talking about compassion right
yeah.
now and the rest. Now in situations whereby you know that these patients, what led them to lose their teeth
Mm,
is fights,
okay.
maybe domestic violence and the rest of it.
Yeah.
Will you say that you are also compassionate to that patient and try to talk the person out from this situation?
See, the first thing about any profession is professionalism. You need to be, irrespective of the background story. You don't attach yourself to the story. You get, it doesn't concern you. You ask for your own record, but
Okay.
you shouldn't attach yourself to any background story. You
Okay.
get, the most important thing, you need to be professional and give the person the service needed. You get, it doesn't concern you if the person is a tout. The
Or
person
not?
came to you for help. You have to dissociate yourself from whatever it is that may have caused that. All you need to do is attend to this problem, make this person comfortable. You get, so that's how I see my patient. I don't see, I dissociate myself from whatever the cause or whatever the drama that maybe are going on around. But there are certain people you can't do that.
Mm.
You get, I was trained in such a way to always consider indigent patients. You get, some patients really don't have. You
Okay.
can't throw them out. In law, there's something called pro bono.
Mm.
You get, you take up a case for some patient free of charge. You get, in my course of training, we call it gracias. There are some certain patients that they need this, but they can't afford it. You don't throw them out of the door. You treat them. That's your own corporate social responsibility, but you have to balance it. You can't do, if you have 10 patients, you can't do gracias for 10 patients.
Mm.
You get, you consider who you do that for. You get.
Okay. Okay. Let's talk about pressure in profession now. What kind of pressure do you face in your profession that you know that if these pressures are not, dealt with, they could lead to a lot of consequences?
Yeah, the experience, as I said, this topic is everybody have their individual experiences
Yes,
based on
yes.
your field. Now, I'm a private practitioner. I work in a private setting. My experience is quite different from someone that work with the government setting. You get. Now, for the government setting, I noticed something.
Mm.
Some of them have this mindset, not all, that I work and no one will pay me. You get. My pay is certain. You get. But for the private, you need to put more
More,
effort.
more
You need
effort,
to
yes.
be more professional, because
Yeah,
if you misbehave, you won't have returning clients. You won't have
exactly.
returning patients. So you have to be very, very, very
You must
professional.
be consistent.
Yes. Though I'm not saying all government workers behave like that, but in the government setting, sometimes I'm tired, I'm going, I'm done for the day. But private, you can't say that certain time, because you may, as I said, it's just like a shop. You can come in today, you won't see one patient, then one
Yeah.
patient walks in and you want to form, I'm tired, I'm not treating you. You get, you have to be very, very professional. Some days are very stressful, some days are easygoing. So it's everybody have their experiences. For me, I'm gonna talk from a private practice person. You get, I take each patient to be very important. I don't do, no, you have to come back the next day. No.
Mm.
If I can see you, attend to you, then give you proper appointments. That's just it.
Okay, okay.
Mm,
Thank you very much. Now, sir, how do you handle patients who think that the pain they are facing
mm.
is from you? You had a curse of it. You understand? Those kind of people, they come in, they don't want to hear anything. They'll be like, "Doctor, you're the one who caused this thing. You're the reason why this
Well,
thing. The
y-
pay
y-
was 5, now is 100 because
yeah,
of what you
it's
did."
proper communication solves that problem. You don't just, you remember, those patients are humans. They have emotion. You don't just work on them as if they are robots. For everything you do, communicate properly. If you have a proper communication with your patient, they'll know what they are expecting. There are some treatments, when you commences the treatment, initially the patient will be, the pain threshold will increase before reducing.
Mm.
You need to tell them way ahead that, see, oh, if I start this treatment, you will feel some certain
Mm.
elevation of pain,
Yeah,
but take your drugs, it will subside. But if you don't tell the patient that and they experience that, are you understanding?
yeah.
They will say, no, 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 I was okay. You get. So I've learned that communicating properly with your patients solve a lot of problems for you.
Mm.
That's just, proper communication solves that problem.
Okay, so before we go on a short break, I want to ask you. This is now based on personal life
Yeah, okay.
and mental health, right?
Yeah.
How does stress from work follow you home?
Well, so as I said, it depends on how stressful the business for the day
Was
is.
okay.
Yeah, you get, it's not easy. You go to work, and from the very onset you step into the clinic, you are having a very busy day. And for me, being a dentist is quite challenging, because you do one procedure from the other. You start from making diagnosis, doing your treatment plan, doing the treatment proper, then placing on drugs and
The
booking
rest.
appointment.
Yeah.
For you go through this routine for every patient. It can be very exhausting.
Hectic.
So sometimes when you're done, when you are in the course of the treatment, you may not know you are really tired till you
Mm.
see the last patient for the day.
There you know,
You know that,
you're exhausted.
I'm tired. Now, leaving that office,
Mm.
you're going back to life, you're going back
Home.
to family,
Yes.
you're going back to friends. You will now find a way to balance. Some people, when I was in my early days, we used, after a stressful day,
Mm.
we just call ourselves, how are you free? Let's go and do one or two bottles. But these days, we don't
You're
do
a
two bottles.
family man now.
We don't do two bottles. You're thinking of
Home.
home. You just want to
Yes.
go home and the rest of them. You get, when you
Yes.
get home too, sometimes you just have to do your kids are there. You want to. bond with
So
them
so you
too.
don't push them away.
No, 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 no. You have to bond with your children. You have to bond with your wife. You have to bond with your friends. But it's not every day you get. Sometimes you're so tired, you go home, and the next thing you do, have your bath, and
You
you
doze off.
just doze off. You
Yeah.
get. But some other days, you just have to do other things that are not work related too. You have a social part of life too. Some people have their religious part of life. You need to find a way to balance it.
Yes. Okay. Thank you very much, sir.
You're
Let's
welcome.
quickly go on a short break. We'll be back shortly. Stay tuned. All right, viewers, welcome back from that very short break. I'm still here in the studio with Dr. Uguchukwu, and so far we've had a quite an interactive section where he has told us a lot. So far, we've talked about more on the patients. Now we are running down into the personal life. So, moving on. So, have there been times when your personal life had a clash with your, work life or professional life?
Yeah, I usually tell people before any title, before anything, you're human. So that human attributes which show themselves. You get being you a sanguine, a melancholic, any your person
Yeah, will
will
come out
always
first.
reflect.
Okay.
You get sometime. There are occasions where I'll forget that I'm a professional. Just someone along the road, mainly when you're driving, and Bosimo person, you just you just forget everything about
Then
being a
you forget about
professional. You
professionalism.
insult the person
Yes.
first. You get.
Yeah.
And the other time, in the middle of your work, you get some calls from home that are unpleasant, and
Mm.
it will just mess up
Disrupt your day.
your day. And if you're not careful, you may transfer certain aggression to not knowing that okay. So in such occasions, it's best you just take a break from
Now,
work.
what about the scenarios whereby these patients, you are home and they know that this is your resting hour and you see that your phone is ringing?
There's
Do
no
you
boundaries for patients in
really?
pain. Yes, my wife usually tell me that. Don't they know? Because she works in the corporate world, so they have closing time. So she try not to. I'll tell you that sometimes my phone rings as late as 12
Midnight.
a.m.
Yeah.
And she was like, "Who's calling?" I said, "I need to pick. This the person calling me by this time is in pain. The person needs me to talk to them." So some people don't know boundaries. They don't know, okay, maybe you see a patient during the day and the patient will be calling you around 11 p.m.
Mm.
And you're like, doctor, I just want to be clear. You said I should, but I have to pick. They are my patient. I have to be professional.
Mm.
But there are certain calls you just said, I can't this wait till morning. You get some people don't know boundaries.
So,
They
but
just
but
feel
but
because you are their doctor, they can call you anytime,
but
which is right.
okay. So
Mm.
in this situation, you can't set boundaries.
See, have you been in pain?
Well, yeah, yeah.
If you've been in pain and you have the number of a doctor, you call that doctor. Irrespective, you will call or you chat. Sometimes you just need advice on what to do to buy time till the next morning. You get. If I can't, some people don't pick. I try as much as possible to pick. You get. It's not
Mm.
as if I'm speaking for everybody. I try as much as possible to pick because you don't know what that call would be. Some people call as late. Oh, doc, I'm in pain. Or you see, you just wake up, you see chats. You get the chat type are better. You get. So that's it. Some you just have to find a way to not to be too strict with these
Too strict.
things. You
Okay.
get not to be too strict with them.
Okay.
Mm.
So, but do you ever feel selfish when you try as much as possible to prioritize your own time and your life? Does that
Again,
feeling come?
again, is subjective.
Okay. Personally to you,
Sometimes,
sir.
sometimes it's your spouse, your friends, or your that would remind you that see, it's not always all about work. You get. I enjoy doing what I do. I enjoy being a dentist.
Yeah.
So as long as I'm in that field, I don't place boundaries. Certain time I just want to help. I just want to treat. But sometimes you'll be reminded, I beg. Like sometimes some patients tell me, say, sir, I'm only free on Sunday. Can you
Mm.
see me on Sunday? And Sundays happen to be my only resting day because I work all through the week.
Yeah.
I rest on Sunday because I enjoy doing what I do. I was like, okay, let me see. Can you come by so time on Sunday? I mean, I've finished fixing that appointment.
Yeah.
Only for my wife, I say, you're fixing an appointment on a
Even
Sunday.
on a Sunday.
I'll say, hey, not true. You get what? As I said, a patient in pain. Mainly, those kind of appointments are okay. They are so busy. Can we? And once I don't have anything doing, I'll say, okay, come over. I'll see you. You get? I don't. I'm not too strict with time. I'm not too strict
And
with
your
time.
wife have come to realize that.
See, I'm a dentist. There are people that are neurosurgeon that you can't. They you see getting married to a doctor. You sign that, you get, but to an extent, you some people, as we grow into the profession, you can be, when you're a younger doctor, you are just open to service.
Okay.
Mainly when you're working in a government setting, you can be on call, and once you're on call, you'll be in the hospital. Your wife needs to accept that. You get, your wife needs to accept that you can be on call. But as a private person, I have more control over my
Over your
time.
time.
You get, I have more control over my time, but it still show itself when patients demand more from you on your off duty hours.
But the way you prioritize your job is different from the way another person does.
Yes.
I've come to realize that you're kind of a person who loves your job.
Yeah, I enjoy doing what I do. That's just the truth.
So why is this not same with other medical doctors?
I can't say not same. I think there's something my wife used to tell me. She said there are very few people that enjoy doing their work. You get, you end up practicing, studying something, and you end up doing something else. I feel in to be a dentist. I'm practicing dentistry and I'm enjoying every bit of it. You get,
Yes.
when you enjoy your job, you see it as an hobby. You it's part of you. It's when you're being forced to do something that you see it as a work. You get, for me, my profession is no longer a work for me. It's like part of me. I enjoy doing it. So I look forward to doing it every time. So my experience with it will be quite different from someone
Someone
that don't
else's.
enjoy doing it. You get, it's different. When you enjoy doing something, it's no longer a work. It's more
Okay.
like an hobby.
Okay.
You get, so the
Okay.
way my wife used to tell me that, Dr. You like your work. I can see you enjoy your work. I say, yes, I enjoy my work. I like doing it. I like dentistry.
Okay. Okay, sir, but
Yeah.
personally to
Mm.
you, everybody is human.
Yes.
We all are human.
Oh,
Yes, I know you love your job and
oh.
I appreciate that. But there are times when you feel like you need a break. You
Yes.
need a vacation. You just need
By
to stay
okay,
away for some time.
this conversation is personal, so I'll explain to you how I work. I work in Owerri, but my
Yes.
family live in Lagos.
Oh,
You get,
oh,
so
okay.
once in a while, I travel, I leave work, I go home, and those are my resting periods. There's nothing you do to bring me from Lagos. I'll tell you, okay, go to the clinic. There's a doctor that will attend to you. Those periods are my off period. I'm not in Owerri. I can't see you.
Okay.
If you want me to see you, then you have to wait. When I'm back, I will continue loving my work and giving you all my time. But once I leave over and I go to face my family, I'm home. There's nothing. I have some patients that come down to Lagos for me to see because I have a clinic. I also operate in Lagos,
Okay.
but I operate in that clinic based on appointments. It's not like I go there every day.
Consistently.
Yeah. So some of my patients, when they find themselves in nowhere, they'll say, "Doctor, I'm in Lagos." I said, "Okay, you want me to see you? Come to this clinic. I'll attend to you." That's a different case. So those period I get to live away are my resting period. It helps me a lot
Okay. So
relax.
you don't ever have that feeling of, hey, I'm being selfish or something like that since it's your rest period.
No, it's not being selfish. I need to balance family. Since my family is not in town, I
Yes.
cannot say, okay, I'll be sending you money. I have to physically be there with them.
Mm.
You get, so I do that almost once in every 6 weeks. I travel
Mm.
to see my family.
Okay.
Then when they are on holidays or my wife is on leave, they come down to Owerri, and that period is also nice. But I will always travel to Lagos to see them.
Okay. So what does success look to you in your profession? What do you see success as in your profession?
Well, for its constant growth. You see,
Constant growth.
growth, yeah.
Growth. Okay,
It's
growth.
like, yeah, success to me is putting a goal, attaining that goal, and putting another goal. You get, it's not
Yes.
just one word. Success is not, because that's same thing with happiness. Because you may think you getting to this height will make you happy. Once you get to that height, you notice that you need another opium. So success is, to me, success is not, oh, I've gotten it all. If it's by I've gotten it all, you would lose the drive to
Mm.
achieve more. So for me, every step, every goal that I achieve is making successful. That's it. I don't wait till I achieve the overall. You have the short step you need to
Yes.
climb before you get
Get
to
to the
that
higher one.
height. So for me, each time I make those steps, I see myself being successful. But when you're stagnant, it's like, oh, nothing is happening. So I give myself short goals to attain before I get my bigger goals.
Okay. So what's that one thing you wish you understood earlier in time? Looking back now, what's that one thing you wish you understood earlier that would have helped you now?
Okay, time management.
Time management.
So
In what area?
everything, how to manage time, because procrastination is just something that
The
everybody
killer of
will of that
destiny.
you get. You just say, I'll do this, I'll do this, I'll do this. Before you know, 6 months you've not done anything. You get, so, but in my early days, I set big goals,
Mm.
thinking, okay, I will do this. So as I grow older, I realize that it's not just setting those big goals; it's by setting a way to get to those big goals. Just little steps. Take them a step at a time. You see yourself climbing and attaining that goal. So if I realized that earlier, I would have been taking it a step at a time, a step at a time, not just saying, oh, I want to be this.
Yes.
And I want to be this is nothing. You have to find a path to it.
Okay.
So allocating proper time for certain things. Yes.
Okay. Okay.
Uh,
So before we round up, what is that advice you would give to young professionals who are still starting out in this area of life?
for young professionals, I would tell them, don't lose sight of that thing you want. It's when you see the older ones living comfortably, doing certain things, they didn't just get there, they were focused.
Yes.
You get,
Yes.
they didn't just get there overnight. Some served, you get, some had to be tutored, some learned from people, some developed themselves. It wasn't an overnight success. So when you're saying that, you should learn that patience and hard work will get you there.
All
You
right.
get, just being consistent.
Being
That's it.
consistent.
Being consistent. If you want any field you find yourself, just being consistent. Ask questions. If there are courses to do, start early. Start applying for those courses. You just get yourself to that place. But when you feel there's a shortcut to it, you make a lot of mistake.
Mm.
That's just the truth. There's no field that you just attain success overnight. Is a gradual. I told my cousin he's into the entertainment world. I told him, okay, how do you want to do this? He said, no, brother, that for now I'm into music, but I'm not stopping. I'm learning photography too alongside. If the music doesn't work,
Go.
the photography will work. Before you know, they will know me, cinematography. I just want to find myself within that field. I say, yes, that's what you should be doing. Don't just put all your egg in one
In one
basket.
basket.
Start, since you want to be in the entertainment world, start. Just keep learning one or two things in the entertainment industry. Before you know, you'll be so balanced in certain things that you'll be like, "Ah, when did I learn all this?" That's what I tell people. Consistency. Don't lose sight of the goal. Just keep pushing. You get there.
All right, sir. Thank you very much,
You're
sir, for
welcome.
coming. Really appreciate your insights. It's really a lot. Thank you very
Okay.
much for sharing. All
You're
right, my
welcome.
people, it has been a wonderful time in the studio. I hope you all heard this. For those in the professional area, you all can, offer a little bit of advice or your take on this topic. And for those of us that are patients, you all have heard it. Not all doctors. Doctors are good, but they should not be seen as a godlike creatures. They are also human beings. Now, for a doctor to be good in his profession doesn't mean that the other person is also as good as he is in his profession. You understand? So do well to drop your comments on our comment section. You can do well to follow us on our Facebook platform, on our TikTok, Instagram, and the rest. Check out the full episode of this on our YouTube platform, and we will do well to get back to you if you have any comments. I remain your host, Goodness Chisom, and this is Serenity TV. Till next time, do have a lovely day. Bye.